So what we wanted to look into is the impact of age and how it plays a role in toxicities and efficacy outcomes in patients receiving CD19-directed CAR-T cell therapies. And what we found is combining all the patients over a select number of years, we're looking at over close to 2,000 patients. And among those patients, about 75% of the patients received axi-cel or axicaptogene ciloleucel or Yescarta, and 25% of patients received tisa-cel or tisagenlecleucel. So these are both CD19 CARs. There was a 75-25 split. And we combined both those patient populations together. They all had large B-cell lymphoma, and most of the patients were seen or treated in the third-line setting as initially FDA approved. And among these patients, we noticed that age, when we categorized them in 4 age buckets, looking at 65 and older, in initial registration trials, 65 and older age population was represented at 25%, but in the real-world database, you're looking at a larger 40 or above percentage. And so there's an increasing comfort of using CD19-directed CAR-T cell therapies for older patients. The next thing we looked into is the efficacy outcomes. Age did not play a role significantly in the outcomes. Across all the age groups, there was not a significant difference in outcomes. When it comes to CRS, there was also no difference in age across all the different age categories. When it comes to ICANS or neurotoxicity, this is immune cell associated neurotoxicity. And so these patients who are older, 65 and older specifically, did have an increase or statistically increased risk of neurotoxicity. We analyzed this on a linear level, and what we found through a multivariate analysis is that there is a 3% annual increase of neurotoxicity with every increase in age. And so this is something important to know and notice as we have an increasing comfort to offer CAR-T cell therapies to older adults, but we do have to be cognizant about patients who have more comorbidities, people who have possibly neuropsychiatric comorbidities. There's some data that we need to look into and correlative studies that we need to do to figure out which patients truly benefit from CD19-directed CAR-T cell therapies. And the older patients, there is definitely patients with preserved performance status, patients with lower comorbidity index. These patients may benefit more, but we have to be cognizant and aware and cautious that some patients do have an increased risk of neurotoxicity, and we need to be careful about that.